Welcome to today's Power of Knowing webinar, the Patient and Caregiver Experience. Understanding comes from knowing. The healthcare system can be very complicated and hard to navigate for patients and caregivers during a time of serious illness. We hope today's presentation will help build understanding on how to establish good communication in the healthcare relationship. This free webinar is part of a series called The Power of Knowing, created by Authoricare Collective, which empowers people to be active participants in their care journey, enabling them to live on their own terms through personalized support for mind, body, and spirit. To get us started, please welcome our moderator, Risa Hanow. Risa serves as clinical and community educator at Authoricare Collective and is also a member of the Cone Health Ethics Committee. She is a licensed clinical social worker. Risa, I turn it over to you.
Thank you, Paul. It is my pleasure to introduce our panelists for today. First, let me introduce Mary LaRoche. I have the pleasure of serving on the Cone Health Ethics Committee with her. Mary has over a 30-year nursing career, and she is an advanced practice nurse practitioner, and she is also certified as a psychiatric, mental health, and a hospice and palliative medicine nurse practitioner. Mary has made use of palliative medicine concepts of holistic patient care in multiple settings and currently serves as a member of the Cone Health Palliative Care Service. Next, joining us is Merrill Seiler. Merrill is the Vice President of Quality and Compliance here at Authoricare Collective. Her passion for providing care started 35 years ago as a bedside nurse in an intensive care unit at a teaching hospital. Those years laid the foundation and sparked her interest in and commitment to quality improvement and healthcare compliance. Merrill has served as a mentor for the Women's Resource Center here in Greensboro. And Alexis Williams. Alexis is the Executive Director of Caregiver Connect, Inc. Caregiver Connect's mission is to serve family caregivers by providing educational opportunities, encounter support groups, and supportive caregiver navigation. Alexis has a wealth of experience as a placement specialist, a care manager. These have all served as wonderful building blocks for her current position. She is also a certified senior advisor. Welcome to each of you, and thank you for joining us. We would also like to know a little bit about you, our participants. The best way that we can do that in our current virtual environment is that we have a polling question, and that will come up on your Zoom screen. If you could take a moment, it is a multiple choice question. So we know that many of us have multiple roles. We may be a patient and a caregiver and a healthcare professional and a human service professional and a spiritual care guide. So please take a moment and respond to all that apply to you. We appreciate you taking a moment to do that. It's a nice way for us to have a good sense of who is joining us in this virtual opportunity that we have today. Thank you. You can see lots of you participating and answering that question. I appreciate it very much. So when we think about the reality of serving multiple roles, we know that that can be a challenge for all of us, no matter what our profession, what we do during the day, and then what we do when we go home. So if we go ahead and look at the results of our poll, we can see that we have a number of healthcare professionals, which is wonderful. We always want to enhance our skills. We also have a large number of caregivers joining us. And we also have a good number of those who are human service professionals, spiritual care guides, and also a number of patients. So thank you all for joining and learning with us. As we begin our conversation, I want to invite everyone who is a participant to make use of the question and answer block on your Zoom screen. You can submit a question at any time during our webinar, and we will do our best to answer as many of those questions as we can during our time together. So Mary, to get our conversation started, tell us in general, what is palliative care? And I think that's important for us to start with, because once we have that understanding of palliative care, you can then help us understand the importance when we have a serious illness of understanding our medical condition, understanding options for care, and how we go about getting that information.
Okay, great. First, thank you all for joining us today. I hope that you find it informative and you get to take away some good nuggets today. Although palliative care is not a new concept, an area of medicine, it continues to be a misunderstood word and misunderstood concept. So I will just give a little overview of what palliative care is. So a good definition for palliative care is it's a specialized medical care for people living with serious illness. The care focuses on providing relief from disease-related symptoms and the stressors of serious illness. It supports the family. The goal of palliative medicine is to improve quality of life for both the patient and the family. Palliative care is provided in a multidisciplinary approach. It's provided by a team, a collaboration of providers, physicians, advanced practice providers like myself, nurse practitioners, physician assistants, nurses, chaplains, social workers, who all work together along with the patients, other physicians, their specialists, oncologists, cardiologists, and other care providers, enhancing patient-centered care by adding that extra layer of support. Palliative care is based on the patient's needs, not the patient's prognosis. Palliative medicine is appropriate at any age and at any stage in the serious illness trajectory. It can be provided along with curative treatments. Actually, that's the best way for palliative care to be provided. Early intervention, right along with diagnosis. And we'll talk a little bit more about that. We know that if we focus on symptom management, psychosocial support, and attention to advanced care planning, the patient and the family benefit greatly. Actually, the new standard of comprehensive health care really does include integration of early palliative care alongside cancer-targeted therapies and other non-oncologic diagnoses, such as COPD, chronic obstructive pulmonary disease, congestive heart failure, end-stage renal disease, and patients who are critically ill in an ICU in the hospital greatly benefit from the input and support from palliative medicine. We know that serious illness does not exist in a vacuum. Life continues on around the illness, and palliative care is meant to be an active and comprehensive form of medical care targeting physical, emotional, financial, and spiritual aspects of a patient's disease experience. Factors contributing to effective coping and hopefully achieving a sense of peace and acceptance regarding an illness requires good communication, trust between patient, family, and the clinical team. So for many people, the opportunity to share hopes and fears and what their illness means to them is actually therapeutic. We need to give people that opportunity. And the attention to both psychosocial and physical symptoms is at the heart of palliative medicine. Access to palliative medicine is growing, and many patients now have that opportunity. 85% of hospitals in the United States with a number of beds greater than 300 have palliative care consultative services available to them. And actually the VA, any of the VA facilities, palliative medicine is mandated. So what can one expect from a palliative medicine consultation? So first and foremost, a provider will sit down with patient and hopefully family and other support people to establish what does the patient and family understand about the medical situation. First, let's figure out what we know, what we don't know, what are the questions and concerns. What are the treatments being offered? What are the risks and benefits of those treatments? And do those treatments fit into the patient's goals of care at this time in their life? They can expect to have a detailed conversation, exploring patients and families' values and goals of care. Just giving people a chance to sit down and talk about what's going on in a very unpressured environment. Time's not an issue. Let's sit down and give some space to this. There will be a detailed assessment of symptoms, not just pain, but expert management of physical and emotional symptoms, non-pain symptoms such as nausea, depression, fatigue. We want to treat the whole person. And then communication with the whole team. Let's make sure that everybody's on the same page, that the physicians understand where the patient and family is coming from. What are their hopes? What are their desires? What are their fears? And last but not least, a focus on advanced care planning. Actually, maybe I should have put that as the first one because it's advanced care planning, but many times, unfortunately, that is not completed or even talked about until we're in a crisis. So better late than never, but advanced care planning is crucial. And that really is just sitting down with patients and families, establishing a healthcare power of attorney, looking at their living will, wishes. There's other forms that we can use that carry through with the patient, follows them home. They have that with them so that once their goals and their decisions are made, they're documented somewhere. So I really see myself as an advocate for patients and families, and helping them navigate what can be a very complicated healthcare system. And that's pretty much an overview of palliative medicine.
That's perfect. And it leads us really, when we recognize a serious illness, there is certainly a lot going on. So Alexis, when we then think about the additional resources, the needs that may be identified, not just for patients, but for caregivers, for families during a serious illness, can you talk to us about some of the resources and the way that we might go about identifying and getting connected with some additional assistance that could be very helpful at some point?
Absolutely. Thank you for having me this morning. I love your question because it really sort of lends itself to some things that I think we all need to be reminded about as a caregiver. So I think your question is a great question. I believe that there's several things to consider when a caregiver is trying to address a lengthy illness. And my first thought is that it helps if the caregiver decides that they're going to address the circumstances from a caregiver and advocate point of view, instead of a relational one, like I'm the daughter to the mother or the husband to the wife. In my mind, it so often helps if the caregiver sort of puts their caregiver hat on and says, okay, I'm going to pursue these things as a caregiver. It helps sort of with research. It helps with looking things up on the internet. It helps with identifying, maybe even as simple as a brochure in a category, that if you think, oh yes, I'm a family caregiver to this loved one, then that kind of gives them a sense of responsibility, but it also sort of takes them out of that relational thing and sort of a task thing. So I think that sort of helps sometimes. The second thing is, I think that it is really important for the caregiver and the care receiver to become educated and informed about the conditions and the diagnosis they're experiencing. I'm not going to talk about it very much, but I just can't tell you how important I think that is for so many things. That if you can identify as a caregiver and then know what you're dealing with, it can be really helpful. The third thing I think it's important to think about when pursuing resources is that a great resource can be spending time with other caregivers. One of the best things a caregiver can do is spend time with others who are similar to himself or to herself. Family caregivers need to know that they're not at it alone, that they have support by being with other people like themselves. I try to encourage every caregiver to find a group, and they can call it a support group, they can call it a small group, they can call it a fellowship group, they can call it encounter group. It doesn't matter. The important thing is that they're either meeting with other people like themselves online or in person, or I've even seen hybrid groups get together. So because of COVID, you have to see what the group supports. Like anything else, I think sometimes it takes a bit of effort to kind of find a good fit. But sometimes when people do find the good fit, which might mean that they're with people who have a similar illness, their loved one has a similar illness, could be it's an all male caregiver group, could be it's an early onset dementia caregiver group, doesn't matter. I think you have to kind of just take the leap, go in, try to meet people and see if it's a good fit for you. But I have found that it's a great resource to be with others because you learn from them, but then you also feel like, oh, I'm not really doing this by myself. The fourth thing that I just want to mention very quickly is that it's important for us to kind of learn as caregivers in our vocabulary to say, can you tell me please what this might look like what this appointment might look like what this experience might look like when my loved one has this test. Can you tell me what it's like to fill out this application? How long will it take? What should I expect at this appointment? I just think sometimes the healthcare world sometimes assume that we know what to do, and often we don't. And things are changing so much in the healthcare system that they themselves who are providing the care are constantly having to evolve. And so I think it's important for the caregiver to know and have permission to ask questions, to say, hey, can you kind of help me know what this is going to look like? And then lastly, I think it's important, and if Paul, you can put up this next slide, I think the important thing is to know that there are resources, there are organizations, there are businesses in our communities that are designated, that have been created to help family caregivers. And I always encourage folks, if they can, to kind of start with the programs that are to serve seniors, and most of them use the age of 60 plus. There's a federal program that hosts the Area Agency on Aging. And within our US, almost every county, township, province has an office on aging, or a council on aging, or a senior center group. And so I always direct people to start with them locally. You can often go to the county website, perhaps, that they may have. You can go to the senior center and ask for services. But in my mind, those programs have existed for a very long time. And so I think it's helpful to start with any local council on aging. So like here in Greensboro, it's called Senior Resources of Guilford. Second, I always encourage people to call the social services department for adults. Now, some folks may think, well, I'm not reporting abuse. No, no, no. What happens is the social services department has to network and work with other organizations in the community. So oftentimes when you share what your needs are, they're a great referral source for you. So don't rule out social services if you're thinking, well, we don't have a need for that. Well, they often are a great referral source. So just keep that in mind. Meals on Wheels program also, not only is it a great service, but those social workers often can connect you with other businesses locally. I always encourage people, don't forget the senior centers, don't forget about adult day health programs and respite programs. Again, all of those programs kind of focus on 60 plus. So I direct folks basically back to the county program or the city program that services seniors. And again, call them and say, hey, I'm caring for this person. Give them a little bit about what you're doing and then say, can you direct me to services in the area? Oftentimes, if they don't provide that service, there'll be others that they know do, and they can give you some suggestions. The other thing I think it's important to think about is that many folks are concerned about their insurance, and we don't always take advantage of what we're paying for. So I often encourage people to know that there's a SHIP program, especially in larger cities here in our state. It stands for Seniors Health Insurance Information Program. And those folks are experts with Medicare and medical insurance. So for example, if you wanted to know what insurance was being provided in the county that you lived in, you could go to their local representative, and for the year, they could tell you what policies are being provided locally. The way you find the SHIP representative is often by going through the county program. They are online. You can put SHIP in and then try to find a North Carolina representative or a South Carolina representative, depending where you are, and then find someone locally. They tend to be in bigger cities, but those folks are untapped, valuable resources that can help you understand your Medicare policies, what you're paying for, and then two, with your healthcare policies. They also can help you if you feel like you have experienced some fraud or scam things with your insurance. They can direct you where to go. But so many of us don't know what we're paying for. So I always encourage folks to print their policy out, read through it, flip their card over and look at member services and call them and say, hey, I am a loved one caring for my mom. Can you tell me what services might be available to her with her benefits? Following that, so often there are organizations in our area, or nationally too, I guess it's important to say, that they can provide information about programs, information about diagnoses. As you see on this screen, I encourage folks, if you like, feel free to screenshot this particular slide. I encourage folks to reach out to the American Cancer Society, to the Alzheimer's Association, like to Michael J. Fox Foundation, the ALS Association, the Heart Association. All of those folks have material to describe the diagnosis that might help you with the symptoms. And then often they have caregiver support programs or literature that they can provide for you. And many of them have opportunities for support in the home or support groups online. So don't rule those big organizations out as options for care or support for you. One of the things I did want to mention too is if you're still working for a company and maybe caring for a loved one, maybe it's a mother or a father or a disabled adult child, Ask your company that you're working for if they have an employee assistance program that deals with caregiver support. Often you are seeing more and more companies, especially bigger companies, offer caregiver support. They're offering assistance with elder care locators. Caring for loved ones has become a very demanding concern for us here in the US, and many companies are having to address that in an effort to show support for their employee. So I mentioned that to you to not rule out your place of work, but then also if someone has retired from a place of work and is receiving their benefits, maybe it's their medical insurance benefits from where they've retired, I encourage caregivers to reach out to that human resource group and say, hey, do you have any caregiver support information that you could share with me? Do you offer any incentives to the retiree to benefit from certain programs that would support me, the caregiver? So don't rule out where you work as something that might be a place for you to seek support, but then also from where someone may have retired if they are seeking those benefits. A couple of other places to consider are organized groups like fraternal organizations, the Masons, the Eastern Star, professional organizations like an engineering professional group or a medical professional group, or faith-based charities like Jewish Family Services, Lutheran Family Services, Catholic Charities, the North Carolina Baptist Aging Ministry. All of those organizations have come to my attention because they're providing support to caregivers in various capacities. So, you know, if you were a Mason for years, reach out to your local Mason group and ask, are they offering anything to support loved ones in their home? Are they offering any kind of at-home care, or are they sponsoring any type of community living? Many of those organizations and professional groups have started to pursue support for their members because caregiving is becoming such a concern for many people. Last three things I want to mention is the AARP Family Caregiver Resource Line. AARP has chosen to really devote a lot of time and attention to caregiving issues. I can't say enough about what they put out. It's very important to kind of explore their website, perhaps maybe attend one of their seminars. All of their information is free, and they really are trying to make a point of supporting family caregivers throughout the US. The Department of Veterans Affairs, the caregivers support the Veterans Aid and Attendance Program. The Aid and Attendance Program especially is one program that doesn't get utilized enough. It benefits both the veteran who might have served in wartime and then possibly the spouse as well. So don't rule out military involvement as a possibility for caregiver support. And lastly, there is a new organization that has kind of evolved because of the demand for caregiving. It's called the Aging Life Care Organization. And that is where geriatric care professionals often will affiliate themselves. And then you can go to that website, put in where you live, and see if they're geriatric care managers in your area. I can't say enough for geriatric care managers because they often really are the folks who are in the know and can really provide some one-on-one support to you as a family member.
Wonderful. You know, Mary and Alexis, you have shared a tremendous amount of information about what we as a patient, as a caregiver, a loved one, even a healthcare professional may reach out during an illness. And we all hope that we get the information we need and it's received in the way that we need it and can receive it best. But Merrill, I wonder if you could spend some time helping us, give us a framework of what is good communication, respectful communication, dignified communication and care that we each deserve as a patient, a caregiver, a loved one. What should we expect? What can we expect? And what can we do if we are not receiving what we deserve to be receiving?
Thank you, Risa. It's so good to be here today. When I think about communication, the reason I think it's so important is it's connected to patient safety. So healthcare providers are often assuming the role of teacher. So we're teaching you how to care for yourself at home often, how to do a dressing change, how to take a nebulizer treatment, how to use oxygen, pre-op instructions. All those things that are very routine for us are very unfamiliar sometimes to patients or their loved ones. And so oftentimes we're teaching you how to do something. And I love us to use the model of teach back. So after I've explained to you how to do something, I invite you to teach back. Tell me in your own words what I just shared with you. Sometimes patients are surprised when they're asked to teach back, and it's really not a measure of the patient's ability to understand or to learn, but it's really a feedback loop to the healthcare provider on the effectiveness of my teaching. Did I miss something important? Could I say it in another way? Could I frame it differently in a way that helps this patient understand so that they can take the medication correctly? So they know, take it on an empty stomach, take it with food. All those things matter to the effectiveness of the care and the treatment. So that's one model that I really encourage healthcare providers to use. And I think as a healthcare consumer, if you're not offered that opportunity to repeat back what you were just taught, I think it's a terrific habit to get in to say, can I echo back what I think you told me? So this is the way I should be taking my nebulizer treatment, using my oxygen. These are the things I need to be worried about. And it's just really a way to ensure patient safety. So that's one important piece of communication, I think. The other piece is around respect. And I think we respect patients in lots of different ways. One in particular is respecting your time. Time is so critical, and we only have so much of it. So, for example, if a healthcare provider is coming into your home, we need to be providing a time frame when you should expect us. If we're running late, we should have the common courtesy to call, let you know that we're running late, reset expectations. I think we need to respect your privacy. We need to respect your property. We need to listen carefully, make you feel as if you're important to us, that you're the only person we're focused on right now. We need to maintain eye contact. We need not to multitask. Patients feel that when we are not focused on them. And so there are times when healthcare providers might not show up with their best self. We might not do a great job teaching. We might not demonstrate the respect that you deserve. And so I think on those hopefully rare occasions when things don't go as you expect, you have the right to provide that feedback to a healthcare provider. And I think it's really appropriate. And I think it's helpful when patients realize that they're really giving a gift to their healthcare provider when they provide them with that feedback, because they're saying to the healthcare provider, I value this relationship and I want to give you another chance. I want to give you the chance to do some service recovery. and to meet my expectations. So those are a couple of things around communication that I think are really important.
I appreciate that. And again, if anyone has questions, you can submit them through the Q&A box, and we will answer as many of those as we can. When I was listening to what Merrill was just saying, Mary, it was making me think back to when you were talking about the importance of understanding what my healthcare situation is. You know, it's a new diagnosis or getting test results. Are there ways that you recommend or help people be able to ask for more information? Because, you know, I might have the same diagnosis as many other people, but I need certain things because of who I am and my particular life and my needs and my family circumstance. So how do you help patients find their voice to learn about a new diagnosis or a change in their condition?
That's interesting. I think that it is important that people understand they are their own best advocate. They're advocating for themselves and their loved ones. And the only way to advocate is to know what you're dealing with. And so that does take a mind shift. And it's hard for some people to really, you know, ask those questions of the physician or the doctor. He's in a hurry. He only has 15 minutes. Oh, wait, I didn't get my question answered. And it really comes back to what Merrill is saying. We deserve and need to ask for what we need. And that means to say, oh, wait, not in a, you have to be prepared. It has to be a two-way street. You can't expect the physician to stay for an hour at every visit, but you should expect to get your questions and concerns answered. So come prepared. Write those questions down. If they're not addressed, stop and say, wait, I need that echo back. I need to know, is this what I heard correctly? And there's an element of intimidation and vulnerability when we're the patient. You know, we're dependent on this physician for care and treatment. So we feel vulnerable. It's understandable. But I think if we have a sense of knowing that and awareness of that, we can move forward with asking for what we need and really getting what we need in a timely manner. I hope that answers the question.
Yeah, and the word vulnerable really sticks out for me. I think that certainly when we're in an unfamiliar environment, Alexis, I'm thinking about your tips in terms of sometimes it's really making one first phone call and then we can be connected. So if we were to call you at your organization or, go to your website or what I'm hearing is sometimes what we need is just that first connection. And then we can sort of leapfrog or let others help us learn. And sometimes being vulnerable in that space of asking for assistance. And we might not even know what we're asking for, but just to even call Caregiver Connect and say, I need some help. Am I correct in assuming that you can be a first stop for us?
Absolutely. And I think what you hit on is exactly what kind of today is about, in that we just need to kind of identify that we have these concerns and then reach out to others to see if they can direct us or help us or support us in some way. But yes, I would encourage it helps to start with one group that might have knowledge of other resources so that you can then be kind of channeled down a path a certain way versus maybe being sent in 12 different directions just to go down one. But absolutely, I think it helps to start with a group that has an understanding of what the caregiver may be going through or maybe like if you called the Alzheimer's Association, it would be because you have symptoms of dementia or concerns that would be similar to that. I think that always helps, that you could start with a professional group or business that could direct you with people who might be addressing those certain needs.
And so Merrill, I want to continue on that theme of feeling vulnerable. And I think this has come up, Mary, you touched on it, which is we are dependent, in our, on our healthcare providers, and we might not feel comfortable saying that didn't feel good, or can you give us some tips or even reassurance that speaking up in the moment is the right time rather than waiting 6 months after something has happened? But talk to us about how we might feel vulnerable and acknowledging that reality, because it can be really hard to say, I'm not satisfied, or that didn't feel good for me.
Right. So there's a power dynamic, and the healthcare providers, sometimes consumers of healthcare feel as if their provider has the power, and we should be good patients, and we should do as we're told and follow the direction. But the truth of the matter is, healthcare providers went into the profession to be helpers. And so I think there are times where we might not show up open, we might not appear to be open, but I believe that's our commitment. And so as a healthcare consumer, if there is a time where you are feeling as if your needs are not being met, you're not being understood, you're not feeling valued, although it's hard, it's certainly in your best interest to communicate that as respectfully as you can, so that your needs are met and that your answers are given. You might need to have the same information communicated several times. Healthcare system is hard, diagnoses are hard, treatments are hard. And so one size fits all doesn't work. And so I think using your voice, communicating what you need is the right thing to do. 6 months from now, when a survey comes, or once you get out of the provider's office and that survey comes, sure, you're giving that feedback, but you're missing the information you need at that time. So I think digging deep and finding the comfort to ask for what you need is the right thing to do.
So we got a question, a comment, and I think it's a very familiar one. And Mary, maybe I'll direct it to you to start with, which is a child, an in-law, recognizing that their loved one is very reluctant to ask a lot of questions. They feel that the physician or the provider is, to be listened to. So if I hear that I need to have surgery or I need to have this treatment done, they are reluctant to ask questions, and then might become frustrated if family members, if children, if others sort of say, hey, Dad, what if we ask? And do you have some advice about how we handle, because thinking back to when you started talking to us, you mentioned the importance of knowing benefit and burden of treatment options. But how do we get to the place where we say, but what if I don't do that? Or what is my other option? And inviting others into that conversation.
I think that is what I love about palliative medicine consultation, because that's exactly what we do for patients and families, sitting down almost as the moderator to say, helping patients verbalize to their families things that they probably have never said. Many people avoid difficult conversations, not just regarding healthcare, but regarding difficult conversations. It's just not in people's wheelhouse to express their needs. And so it is an ongoing conversation, empowering and creating a space. I think that's part of it too, in creating a space where patients feel comfortable, where families feel comfortable, decreasing that sense of vulnerability and allowing them to verbalize what both sides are thinking, and providing knowledgeable information regarding diagnosis, prognosis, treatment options, really laying out the information as we best know it, and letting them have time to digest that, take it in, and process it within their own values and goal system.
So Mary, am I correct in thinking that sometimes a palliative care consultation, if somebody's in the hospital, or like with AthoriCare Collective or other organizations that have home palliative programs, how is it that we get palliative care involved? Is it always needing to be recommended by the physician? Or am I, as a caregiver, a patient, a loved one, able to say, excuse me, I've heard about this. Might that be helpful?
Absolutely. And I would empower every person and family members and caregivers to ask for palliative care. It does have to be ordered. It's a physician ordered by the physician, but that again is that conversation, getting what you need. Doctor, I know about a service, the palliative medicine service. I think they could be helpful to myself and my family, helping us talk through this situation. And honestly, I would also prepare people that they may have to educate their physician on what palliative care is and what they have to offer. At the very beginning, I was saying it's still very misunderstood. And even many physicians do not understand what it is and the power of palliative medicine within the healthcare system, and what we really can offer for patients and families, improving quality of care.
I appreciate that, because I think there is a lot of confusion about what it is. I think there's also, for many services, and Merrill, I think about this in terms of good communication, but the healthcare provider has to know my story, has to know Risa. We have to be treated as a person, not as a diagnosis. And that, to me, when we think about maybe dignity, or what do we deserve in terms of being treated as an individual, as a person, and how do we ask for that?
So when I think about dignity is about honoring and respecting. And so it has to be about the individual. And so it's not about a COPD diagnosis or heart failure, cancer. It's about Merrill's cancer or Merrill's diagnosis. And so I think healthcare providers, there's always that risk that we think about what we're treating, and not who we're treating. I was also thinking when Mary was talking about all this information we're given, the value of writing things down. So you go to a visit, you have a conversation with a healthcare provider, you receive so much information, and then you have a debrief with the family. And the family says, well, what did they say about this? And what did they say about that? You've had that conversation, but it's so much. It's hard to retain it all. So showing up with a list and then leaving with some written information, I think is really, really helpful. But back to the dignity and respect, it's about the human being. And as healthcare providers, we need to respect folks' differences. We need to respect their choices. And so once we provide information, patients have the right to choose to do nothing with that information, to choose to explore other options. But it's about the unique individual, care directed specifically for that individual, given what we know about a diagnosis. But they have a unique history, and that needs to be honored.
And I'm being mindful that we're coming close to the end of our time together, and I wanted to sort of think about our takeaways. And one thing, I mean, you just said, Merrill, about writing down, and I think about bringing a person with us. And in this virtual world, I know that I've had the chance to, with a parent being physically at an appointment, and then I could join it virtually, and sometimes having to be creative with how we're able to be involved and asking to be involved, to be another set of ears, and also wanting our participants to know that the resources that we've been talking about, particularly Alexis, your organization, we will be sharing the link so that people can, reach out to you with questions or follow up on some of the resources. But I'm thinking, Alexis, as a takeaway for us, each person has a level of comfort. You said social services, some people might say like, oh gosh, I have a bad association with that. So is a takeaway for us that we should go where we're most comfortable as long as we go somewhere?
Yes. And I think that it just helps to start somewhere and to get some guidance and some direction. Certainly it helps if you kind of know what you're dealing with, the circumstances. If you're trying to find transportation, then start with the transportation group. But in my mind, you have to decide, I'm going to act on this, I'm going to pursue this, and connect with other people as best you can to support you in your caregiver duties.
And Mary, I'm going to pull that thread that you mentioned about advanced care planning, and I want to circle back to that maybe as you share a takeaway for us, which is we shouldn't be waiting until we're ill or until we have a diagnosis. Tell us about why we should be thinking about naming someone who could speak on our behalf or completing a living will today, and not waiting.
As I was sitting here thinking about what my takeaway was going to be, because I had already said it somewhere else along within this conversation, I thought it has to be about advanced care planning and the importance of normalizing conversation with your loved ones at the kitchen table, when you go for a walk. What would I want? What wouldn't I want? What's important to me? What's quality of life? So conversation first is of utmost importance, that we talk to the people that are our support people and involved in our lives. And then absolutely documenting those wishes, naming that person as healthcare power of attorney who knows you, who knows what you would want in the what ifs. And along that is then the living will kind of piece, which is, what would I want in certain situations? The two big things that people talk about are resuscitation and feeding tubes. It is important to talk about those things, document them, have the documents readily available, and know that just because you documented something 20 years ago, it probably doesn't still apply today. So the importance of not just one and done, but continuing conversation all along our paths and life journeys specific to our healthcare needs and wants.
Great, thank you. And So Merrill, I have a question specifically that I would love as the takeaway, which is if I am not receiving the care that I think I should, how do I know who to call? I mean, what do I do if I am being served by a community-based health organization, or I have a loved one in a hospital, or like where do I start? Who do I talk to?
Well, in a home care organization, there is a book, and typically there are resources provided. In that book, there is information about who your people are, who is your case manager, who is the director, who is the vice president of quality. So there is always a person. I think ideally, if you can bring it to the attention of the person in front of you at this time, that's ideal. That's ideal, but there is a whole chain that you can move up to be sure that that your complaint is heard and that it's addressed. And I think the key takeaway for every single person is to know that you deserve to be treated with respect and with dignity. And my hope is, whatever your healthcare journey is that you find your voice to advocate for yourself. That's really important as you experience any healthcare.
Thank you. Thank you each. This has been really a wonderful conversation, not just because you have shared your expertise, but you have shared your passion and your compassion, not just for the work that you do, but really for the people that you have the opportunity to work with. And I want to thank our participants for joining us in this conversation. These can be hard conversations. I also want to let you know that everyone who had registered will receive a follow-up email tomorrow. And that's part of you having your voice. So there'll be a link to the recording from our webinar if you want to listen again, or you want to share it, perhaps with somebody else in your life. There'll also be information, links, contact information for some of the resources and our panelists, so that if you want to follow up, you have that place to start. And in addition, you'll also be able to respond directly to that email. It comes right to me. So if you have a question that was not answered, please send that to me and I will do my best to answer it just as quickly as I can, or reach out to the right person. I also want to bring everybody's attention to our conversation that we will be having. Our next Power of Knowing is on the whole person-centered care, which is really in keeping with what we've been talking about today, what we all deserve to receive. And so we have a wonderful panel that will be joining us on Tuesday, November 16th at noon. And I hope that as you receive information, you will take the opportunity to register and join us for that. And I know that it will be a very good conversation. And in closing, I want to share a quote which really touched me, because we are talking about the human connection. And so this is a quote from Amy Lee McCree. And what it says is, kindness can transform someone's dark moment with a blaze of light. You'll never know how much your caring matters. Make a difference for another today. And we each have that opportunity. So thank you for joining us. And I hope that everyone has a good and safe rest of the day. Thank you.
Thank you.